Where do you stand on it all, Peter?
Well, IVF, I think it's a happy thing, and often, not always, alas, but it has happy results. And I like the idea of money which I've spent on tax being spent on helping people to have children. There are so many other things that we do, from tattoo removal to abortion, which, frankly, I could manage without, as things on which public money is spent. And I don't think that I can really object to IVF treatment. So, leaving that smaller issue aside, if we really want to take the health service seriously, then we need to remember it was originally set up actually to deal with a population which had been shattered by very hard manual work and by war. People who were ill, old, tired, and in many ways physically broken by many, many years of hardship. And the health service, which developed initially under NIBEV, helped people like that quite a bit. But we now have a system which doesn't really have any defined purpose. If we are really serious about national health, I think the government should make many more interventions to allow people to live healthier lives. I think that particularly we need to do something about transport, so that people simply get exercise built into their lives, walking and cycling rather than using cars. The whole of our society needs to be redesigned to achieve that. That would, at a stroke, remove an awful lot of disease and ill health. We also, I think, need to give people, not punish people for living lives which are unhealthy, but reward people for making an effort to live healthy lives. So you get tax breaks for looking after yourself. And so that if you do look after yourself, you keep your weight down, you stay fit, you pay lower taxes. I think that would be a very, very strong incentive to.
But how would that work?
How would it work? It's a very interesting.
Big Brother clinic
I think no. If people can volunteer for it, anybody who doesn't want to volunteer for it doesn't have to do it. But if people want to volunteer for it, and their doctor helps them to do it, then I think it's a very, very good way of encouraging people to treat themselves better. And I don't see any argument against it. It must be more sane than the vast, bureaucratic, ineffective, often actually quite incompetent and worryingly bad organisation in some cases, which we all know about, that doesn't actually make the nation more healthy, doesn't actually do the job it's supposed to do, and inevitably, year after year, spends more and more money on being less and less effective. If you want a national health service, encourage people to live healthy lives. Don't wait for them to get ill and then try and pick up the pieces.
What do you